Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. Check it out. I'm here today with Mike. What's up, Mike?
What's going on, Buzz?
Mike's really excited today, I can tell.
I'm jacked. Well, listen.
You're on fire.
My favorite thing about this show is you always talk about stress and stressors and all that kind of stuff. And everybody in this room except Jim has it today. So hopefully it won't come out though.
Jim's lying.
Oh, Jim's always lying. And Jim's like, no, everything's totally cool. It's not cool. Oh, Jim's going to get on.
No, I'm not stressed out. I'm in a really good mood because you know what happened within the last 7 days?
Tell me.
My two favorite sports teams have won.
What
My
team-
two
what team
favorite
are those? What
sports
teams are
teams.
those?
My favorite sports team is whoever's playing the Dallas Cowboys, in which case it was Houston.
Yeah.
My other favorite sports team is whoever's playing the New York Yankees. So both the Yankees and Cowboys lost, so I'm very pleased.
Listen
and
to-
the Buckeyes won. Go
Listen
Bucks.
to the stress in his voice. You can just hear it. Buzz, what I thought was important today is, and I don't know if you're going to cut the break early, but we were going to talk about stem cells and the uses for athletes. And we can get into that now, or we can wait till after the break.
We'll cut the break, and then we're also going to, Jim's going to talk about Coach Corey a little bit too today.
Yeah, Jim is now an expert on Coach Corey.
So we're going to cut the break, and we'll be right back.
I love when Jim gets on the microphone. It's one of my favorite things because I'm like, what's he going to say?
What's crazy? What crazy stuff is Jim going to say? Oh yeah, that's why I'm in a good mood. And go Bucks! All right, here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. Check it out. What's up, Mike?
I'm doing well. I'm doing well after the break. I should say before the break we talked about a little bit of stress, but right now this is our go time. This is what we really enjoy doing. So let's get into it.
Let's go. So I think we're going to talk today a little bit about stem cells.
Yes.
And we're going to start off, and I think you wanted to talk about stem cells get a bad rap sometimes, right?
Right.
And I kind of want to talk about that a little bit, and like talk about where these come from, and unfortunately, let's start off with where the stem cells come from. So stem cells, there's only two places you can get stem cells. You can get stem cells. Now we're talking about stem cells for orthopedics, okay? Orthopedics are joint issues. So you can get it from bone marrow, doing a bone marrow aspiration, or you can get it from an umbilical cord tissue. Now, I would tell you that in the United States, it's illegal to use aborted babies or any of the such for stem cells. So the tissues we use at Buckeye aren't aborted babies. They're people that have elective C-sections.
They're donated.
And they donate the umbilical cord. And the cords we use are only C-section cords, not vaginal birth cords. And that's really important because cords that happen during a regular birth, vaginal birth, are compressed, obviously. They get squeezed when the baby comes out of the canal. And the problem with that compression is it squeezes a lot of the nutrients and a lot of the stem cells out of the cord into the baby, which is really good for the baby. But if we're using it for a donor situation, it's not as good. So we only use C-section cords, which is important. Those cords are more expensive, but of much higher quality. And I said, and another place you can get them is bone marrow. Now, I will tell you at Buckeye, Dr. Bainin and myself, we're both fellowship trained in stem cells. We've done the bone marrow aspirations ourselves. We just choose not to do it because bone marrow doesn't make a lot of sense. And I'll kind of go over why using bone marrow for orthopedics makes no sense. So, number one, donating bone marrow hurts. You can numb the skin, you can't numb the bone. So the procedure itself is very uncomfortable. You literally are drilling through a person's hip bone to get to the bone marrow.
Which is the most painful thing you can ever do.
Yeah, drill into bone. If you have to try getting a cavity filled without Novocaine, right. It's kind of the same type of thing, right? The other, and the sensation you have once you start to aspirate the bone marrow out of that hip joint is a tremendous amount of pressure, which with procedures, pressure with injections doesn't feel good. So it's a very uncomfortable procedure. Now, that being said, if it was a better way to get stem cells, we would do it, okay? But the other problem with bone marrow is at most 1% of the bone marrow cells are what we call mesenchymal stem cells, which are the type of stem cells you want for tissue growth. Now, there are other types of stem cells. There's hematopoietic, which are blood stem cells. There's epithelial stem cells. What you find in bone marrow is a lot of the hematopoietic, which are blood stem cells. So if you ever hear of someone who's has like some type of blood cancer, you would want bone marrow because you want blood stem cells.
Right.
That's why people with leukemia, they do bone marrow aspirations and donations, and that's really
Well, that's
good
where
for
you
that.
hear it the most. You hear that, I mean, when it is that, to the level where it might be terminal, that's where they're using
Yeah, and it's great for that, if you have a blood disease and bone marrow is an option for you because you need blood stem cells, it's really good. It's painful, but that's the right type of stem cells. But if you're trying to fix bone on bone in your knee or your shoulder or some type of chronic injury where you need tissue growth, it's just the wrong stem cells. You want the mesenchymal, which stands for tissue stem cells. So, and we know with umbilical cords that 25 to 35% of the stem cells in that cord are mesenchymal stem cells. That's a higher concentration than anywhere in the body or anywhere. And I do not want to make sure not to confuse that with umbilical cord blood. Because often I'll do lectures and people will say, well, you know, when my kid was born, we saved the umbilical cord blood. Can I just use that blood for the joint? And the answer is no. Because umbilical cord blood has lots of blood stem cells. But once again, you're down to about 0.00, it's actually less, 0.001% of those stem cells in the umbilical cord blood are actually the mesenchymal stem cells. So the reason people save the cord blood when they're born, and I save my kids' cord blood, is if my kids would ever, you know, heaven forbid, have some type of blood disease, instead of doing a bone marrow aspiration, we'd be able to tap into the umbilical cord blood they had, and that would be great, right? But you would never, my kids, if they have bad knees in the future, we wouldn't harvest their blood because it doesn't make sense. It's just the wrong thing. Even though we have it, it'd be free. It wouldn't make sense. It's the wrong stuff. So that's to clarify. Now, I also want to clarify, you know, unfortunately, we talked about this. This therapy works so well. It's becoming mainstream. You're hearing more and more about it. You hear about it on TV every day. Athletes are using this. Stars are using this. So it's becoming very mainstream. The issue I have with it though is any provider with zero training can go buy it and do it, and there's a lot more to it than just taking the procedure and injecting these cells into the body. It just doesn't work that way. You have to prep the joint. You have to make sure the joint is healthy, and then you do the procedure. Just injecting a stem cell product into an unhealthy joint isn't going to work. And unfortunately, there's lots of providers out there doing that. They're advertised. You come in, they're charging $5,000 to do an injection. They don't prep the joint. And the results, and we have quite a few people at Buckeye. You know, we've done over 1,000 procedures at this point. I bet you 20% of those procedures are people who have gone to other places, either locally or they even fly across the country to it, and they were failed procedures.
Well, you've said that before when you've done these lectures and someone said, I've done this before and it didn't work, which always stuns me because I'm like, then why did you come to this?
Right.
But one of the things that happens is you learn this through all your training is, you know, the numbing agent that you use. Sometimes that's killing off, you know, maybe 40% of what's getting in there. Just because somebody is authorized to do it or can do the procedure doesn't mean they know all the cause and effects and the best way to get, you know, great results out of it. An injection itself is not the answer. It's doing it properly.
Yeah, you know, and the way I like to explain this to people is if you get cut, you start to bleed, you put a Band-Aid on it because you're bleeding. But if you think about it, why does a Band-Aid that's supposed to stop liquid leaking out of your body have holes in it, right? And the answer is because what heals your cut are stem cells. Stem cells will not work without oxygen. So, and that's why you don't put duct tape on cuts. It'd be cheaper, right? You just get some duct tape on there.
I do that all day.
Yeah. But if you put duct tape on a cut, guess what? The cut won't heal because there's no oxygen going to get to it. So stem cells have to have oxygen. So if you put stem cells into a person that has bone-on-bone knee and you don't do, you know, we use ozone, we use high-powered laser, we do shockwave therapy. We do all these things to get some air to that joint. You know, think of it as CPR for those stem cells when you put them in there. If you don't do that, it's not going to work, period. You know, so, and that's why if you're going to a provider that's not doing at least shockwave and ozone with it, and you're doing a stem cell procedure, it's not going to work out. You're wasting your money.
And that's something you should ask, right? That provider, before they do it, do they also do that as a follow-up or in conjunction with?
I mean, the most important thing is ask what formal training have you had? You know, have you gone to a university for training, or did the rep come in and give you a 5-minute presentation? You know, if you're going to, I mean, you wouldn't go have an open heart surgery to a general practitioner that had no training on open heart surgery, right?
Or that had an
or knee replacement. Let's say, yeah.
Right. If we're doing a discount, if you come in, like if you're seeing something like that, that is just revenue based, not result based.
Well, there's a group in town that actually, it's a crazy model. So these guys, they come into town once a month, they do a stem cell lecture. They have a doc in town that hasn't had zero training to do the procedure. So they do a lecture on a Monday. They get you to come into the office on Tuesday and Wednesday. They have salespeople there that sell you on the program. They collect your money. And I think they charge $5,000 or $6,000. And then the doctor's there on Friday and he does a bunch of injections and they leave town for 3 weeks. You know, what kind of support is this?
Right.
So what happens if something doesn't work out with the stem cells? What happens if you're not getting results? These guys don't even, they're out of Atlanta. Like there's no, if you're seeing a physician, make sure they actually reside in your town and they're there on a daily basis to support you.
So you're going to follow up if there's a problem, or just if you're having residual, aches and pains, maybe the ozone or shockwave would have helped you get through that.
And there's other tools in the toolbox too. There's no cookie cutter on this, but you have to see a physician, actually a group that is here in town. This is what they do. You know what I'm saying? So the questions I always say is, number one, what university did they get trained in to do stem cell procedures? Not where they went to medical school, because there's no medical school training on stem cells. Where did you get your fellowship level training or higher level training on stem cells?
Well,
and if they can't answer that,
you also think about, we've talked about this so many times before, about high dollar athletes going to Europe because that procedure, they have it down pat over there.
Mm-hmm.
Because it's more of a new thing here that's coming into acceptance.
Mm-hmm.
These physicians aren't doing what you're doing, where, you just went to Mississippi a couple weeks ago. You've been going all over the country to maintain this level of education, whereas they can't leave their practice for 3 or 4 days. Like, you're leaving, shutting things down to go learn more about it.
And Dr. Bain is leaving next week for 5 days to get further training on stem cells and ozone.
Right.
So she'll be gone for 5 days.
But again, if your physician is doing it, I would want to know how many of these lectures, seminars, educational pieces have you gone to, not just read on the internet.
100%. 100%. And are they doing other ancillary stuff with it? And then the final thing is, are they using the right product? We talked about it on the show before that, there's some other products on the market. There's umbilical cord blood and there's amniotic fluid. Very inexpensive. Cord blood's dirt cheap, and so is amniotic fluid. There's people out there locally that are doing blood injections and amniotic fluid injections and saying there's stem cells in it. There's no live cells in amniotic fluid. It's an excretion. It's dirt cheap, but there's no live cells. So them saying this is really false advertising, which is a big deal, but it's not going to work.
But you'd have to be educated as a consumer.
Well, they don't know. They go there. The
right.
doctor says, "Hey, these are stem cells. They're from a baby." Da da da. And people don't know, and they're getting taken advantage of.
Right.
And what's really sad, and from my experience, is the doctors don't even know. A sales rep comes in there. Hey, you can, buy this. Amniotic fluid is dirt cheap. It's like $100, and you can sell it for $5,000 once you put this in your practice. All they see is dollar signs. Hey, we'll do it. And no other training whatsoever. Stick a needle in and make $4,900. Great.
Right.
And that's what they're doing.
You try to get 10 of those a month and look at how your practice increases in revenue.
Yeah. So there's no live tissue or no live cells in amniotic fluid. It makes no sense. They actually sell a product that's room temperature. So you buy this, and it's not even in a refrigerator. It's just room temperature, and you can just pull it off the shelf and inject it in. That makes no sense. And then the cord blood, and I had mentioned this on several radio shows ago. Umbilical cord blood not only is the wrong cell type, but there's also huge issues. Blood, as you know, has antibodies. They call them HLA antibodies. That if you get someone, that's why when you get a blood donation, you got to get your blood type tested, because if you get the wrong blood type, you could literally die, right? Well, the same thing happens with this cord blood product. There's a strong possibility that you can have an autoimmune response if you got the wrong type. And just recently, last week, there was a nationwide recall on the majority of the cord blood products in the United States. Recall. And because people were having immune reactions. They were getting sick.
Oh, I did see that. I think you sent that out to your patients, and I saw that email. That is crazy.
Yeah. Well, here's a crazier thing. So I consult and lecture all throughout the country with a bunch of medical doctors. And so I said, as soon as I saw that on the FDA website, I sent out to, I probably have an email list of 1,000 doctors. Hey, make sure, don't treat patients tomorrow with it. The companies weren't even warning the providers.
Right. Well, I did. After
like,
your email, I saw the follow up, and there were articles out there that they had not reached out to people that they had just done these procedures on, but they were still seeing patients live with this same.
I had a guy call me. He's like, "Dude, I have a patient on the table now. Is this a real thing?" I'm like, "Yeah, don't put that stuff in, man."
How would you explain? This is off topic, but if that comes up, what is the proper thing for them to do? I mean, to tell the patient there's a recall on this.
There's a recall. Can't do it. Recall.
But my question is, are these other people who are not fellowship trained, are they looking at it and just saying, I didn't hear about it, I'm not sure about it, and I'm still doing it? Because again, like you said, a group's coming out of Atlanta, there's a doctor administering the procedure. Does anybody really care? Because the result is, those guys are going out of town again, they're coming back in another 3 or 4 weeks. There's no follow-up.
They don't care. If something bad happens, guess what? They just don't come back.
Right.
They're not here. I mean,
right, that's the worst. But I mean, at least with you,
like, would you have a open heart surgery with a doctor who flew into town once a month?
No.
And if something happens in the meantime, then I guess it's tough. And if something is really bad, he doesn't even live here. He doesn't care about Columbus or
well,
about
when it's that big a procedure on your body, I mean, that's all you got. You got one body. You'd want to know that somebody was trained, but also that somebody
they're here
cares.
to support you.
Right. The aftercare part of it is the more important than
It
just
is more
getting
important.
it done.
I always tell people, if you're better off getting circulation to the joint. If you can only do one or the other, I would rather get circulation to your joint than add stem cells. Now, together, miracles happen. Bone on bone knee, people schedule for knee replacements or hip replacements. They don't have to have this procedures done. When you do them together, miracles happen. But if you came to me and said, Buzz, I can't afford to do shockwave, and I can't afford to get circulation there, or just stem cells, just dump stem cells in there, I wouldn't even do it.
Right.
Because it's not going to work. I'd rather say, let's work on getting circulation to your joint and see if your own stem cells can fix it.
Right.
That's a better choice.
Or, I mean, whether it's shockwave, PRP, whatever, there are steps, there are gradual steps to get there. Stem cells are
if you need to add additional cells, that's the end game. But stem cell injections by themselves, even if they're the proper type of cells, do not work without the ancillary services, the other stuff, getting circulation, being a healthy host. If you take grass seed and throw it on concrete, guess what?
It ain't gonna grow.
Right, and that's what you're doing when you're injecting just stem cells into a joint and you don't do it the ancillary stuff.
Is that why the shockwave and ozone that you kind of touched on a little bit? But is that getting that blood going, getting that oxygenated? That's what's really increasing the success rate of the stem cell injection, right? It's not just the shot alone.
Correct. So what shockwave therapy is shockwave therapy is we use high pressure sound waves, not to be confused with ultrasound. This is a whole nother level.
Well, I think that's why you got to break it down, because I think some people, if you've not
ultrasound wouldn't do anything. Ultrasound's useless. So shockwave therapy is high pressure sound waves, and basically what those do is when they go into when we do it on a joint, it opens up blood vessels. It literally opens them up. And it also causes new blood vessel formation. That's why it's also used successfully with a lot of people that have erectile dysfunction. Erectile dysfunction is the blood vessels over time become congested and clogged. You put shockwave on it, it opens the blood vessels back up and creates new blood vessels, thus your ED is fixed. But you can apply that same technology to joints, and it improves the circulation to joints. Because what happens to people, once you get through puberty, your circulation to your joints really decreases. So that's why if you have a joint injury and you're through puberty, and it's a significant injury, it won't heal because you don't have circulation there.
Because of the inflammation, or just because over time that
no circulation, terrible circulation. That's why if you think about it, when you get older, you don't have muscle issues. You have tendinopathies and joint issues because tendons have poor circulation, joints have poor circulation, the discs in your back have poor circulation. So the only way to heal a disc in your back or to get rid of a chronic tendinopathy is to get some circulation there, and that's what we do with ozone and shockwave therapy. And that allows your own stem cells to work. That allows you to heal like a young person. You don't ever, young kids, high school kids don't have tendinopathies that last. How much less do you have a high school kid with a herniated disc in his back and doesn't get better? They get better because they got great circulation.
Especially on Friday nights, those kids are having that issue and then they just get right back up. If that was me, I'd stay down for about 3 to 4 days.
But for adults, tennis elbow, medial epicondylitis, patellar tendonitis, those are conditions that, plantar fasciitis, these are all things we all heard of. As adults, that don't get better. People suffer because there's no circulation, they don't have the ability to get better.
But they're reversible, right? They're issues that are reversible.
100%. And not with cortisone. So then people have, they'll go to cortisone, which cortisone is the exact opposite of this. So cortisone is the exact opposite of stem cells. Cortisone, although it's a strong anti-inflammatory, kills stem cells and weakens tendons, weakens joints.
Well, the problem with cortisone shots is it's not, I think you've said this before, it's not really solving the problem. It is dulling the problem temporarily.
And making it worse.
Right. So you can walk on it, you can move around on it, but over time, it becomes more debilitating.
100%. And weaker. If you're doing cortisone injections, more than one on any joint, you're just fast-tracking surgery. You know what I'm saying? So because every cortisone injection causes up to 8% bone loss, weakens the tendon, thins out the synovial fluid, which is like the fluid in your joints. It destroys everything, right? And you might say, well, why is my doctor doing it? Well,
because that's what they're trained. I mean,
That's
they're
what they're
trained
trained
to
to do,
they're trained to
it's a
get you
strong
back out
anti-inflammatory.
on the street, to go back to work, to be with your kids and all that. They are trying to give you a solution that temporarily it'll stave off the pain, but it's going to lead to something worse down the road if you keep doing that.
Yeah, 100%.
How many people do you think that you've talked to that are coming to the stem cell lectures or coming to the office that have had cortisone issues? Because I know you've dealt.
Oh, the majority. Well, the crazy thing now is insurance companies, a lot of times they'll mandate we have to do a cortisone injection before we're allowed to do therapies, which makes zero sense.
Right.
So
I'm
you
going to
come
dull
in
the
your
pain
knee
so you
sore, I'm
can't
not
tell
allowed to
it's
do
working.
anything until I do a cortisone injection. So we don't do it. We just say the patient has allergic reaction. I mean, because it doesn't make sense.
Yeah, you got 1,000 people that had an allergic reaction.
But that's the insanity of healthcare. It's insane. It makes no sense.
So, what is the end goal for the insurance company? This is just what's recommended.
Cortisone's cheap, it's inexpensive. You know, cortisone, the medication itself is probably $3 to $5. So it's
Right.
cheaper than paying for therapy. It is a strong anti-inflammatory, so sometimes it'll get you out of pain. But the question is at what cost? I always mention to people, you're only allowed to get 3 cortisone injections per year per joint. And the reason for that is anything more than that would be medical malpractice. That's how much damage occurs. Because if you do 3 times 8, remember it's 8% bone loss
you're
every
losing
time.
24%.
24% of the bone mass, 24% of weaker tendons.
And if you do that over a couple of years, because there are people that have chronic shoulder.
Yeah, they
knee
go 3. They
issues.
get their 3 a year.
Wow.
But those people always end up having joint replacement surgery every single time.
When they get in that situation, though, so they've come to you at this point because there's so many tools in the toolbox. Is stem cells something that you talk to them about and say, let's see if you're a candidate first, or how's that work? If there's somebody that's listening and they're having chronic inflammation and pain, I know there's a million different ways to solve it, but what's the one way that somebody would know stem cell is for them?
You really have to come in and get evaluated by the medical staff, and I'll tell you, a lot of people come in thinking they need stem cells, and we just need to get oxygen to the joint, so we don't even do stem cells on them. Stem cells are like for the worst of the worst. You're bone on bone. You're going to have a knee replacement, shoulder replacement, back surgery. Those are stem cell candidates. But a lot of people come in and they just have chronic knee pain, and they, well, stem cells help. Well, you don't even need stem cells. Let's just get the joint healthy.
But that's the cool part, is that you guys are evaluating everybody. It's not a group. Even when you do these seminars, it's not a group like everybody's a candidate. Some people, you just want to find out what's wrong, and here's our course of action. Whereas what we're talking about with somebody else that's just marketing this $5,000 for stem cells, whether they have the legit thing or not, that's not the point. It is you're trying to get somebody back to optimum health, no matter what age they are.
Yeah, the guys that come in from out of town, guess what? Everyone needs stem cells because they're here. That's the only thing they can offer, one and done. At Buckeye, the majority of people don't get stem cells when they come in. We usually do other stuff first, right? So stem cells is like the last resort. So when you come to Buckeye, here's the difference in how we look at things. We're a medical facility. When you go to a traditional orthopedic surgeons, they do surgery, right? So when you go to an orthopod, if he can't do surgery and you're complaining of pain, you're not ready for a candidate for surgery yet.
You can't do anything.
So we'll give you cortisone. Because that's fast-tracking surgery. We're not ready for surgery yet, so we'll give you the cortisone. Not being cynical, but that's going to get you closer to surgery, right? And there's a lot of people out there that said, doc said sooner or later I'm going to have surgery. We're just doing cortisone for now. Well, guess what? You're fast-tracking it, brother.
Right.
Like you're destroying the joint. When you come to Buckeye, we look at how can we get the body to heal itself. So traditional medicine, when you go to a traditional physician's office, what medication can we give you to mask the symptom? When you come to Buckeye, we look at you and say, what can we get to get the body to heal itself?
Right.
So
To
we don't do
address
anything.
the
We
actual
facilitate
problem.
the body healing itself.
Right.
So just a different way of looking at it. And it works. That's why athletes do that. Athletes don't do cortisone injections anymore. Unless it's game 7 to the finals and they need to play tomorrow. Cortisone works quicker than that. And that's why all the ex-NFL guys have artificial knees and everything. They're a mess. Because back in the 70s, that's all they knew.
Right.
That's old technology.
It was also that's what the team doctor to get you back out there.
Yeah.
If you're living a day-to-day lifestyle where you're an accountant or something, there's no need to do that. And it
Makes no sense.
The fact that you're not a traditional athlete, it's going to lead you down a path because you're not working out as much. You're not using your body that way. So you have to take care of it because your career is going to last till you're 50 or 60 years old. you don't want to have problems sitting down in a chair or getting up and walking around the office. Some of those things can be staved off without surgery.
People always, everyone, you save your whole life to retire and have this good retirement. But if you don't take care of your body before you retire, what is it going to be? Sitting on the couch and back pain and neck pain and knee pain?
Right.
What the hell is that? That's why the whole anti-aging thing. I mean, people, save for what? If you can't be active and go, ride a bike or run around with your grandkids, what's the point of retiring?
It's all about the quality of life. That's what you're not retiring so you don't have to work. It is your quality of life to have more time to spend
To do stuff.
doing what you want to do. But if you can't do anything because your body's giving out on you,
What's the point of living?
right? What's the point in retiring?
Yeah,
Might as well go to work and sit there, 8 hours a day.
Yeah. So, to conclude, so if you're listening to the show today and you have chronic injuries of some type, chronic back pain, chronic knee pain, chronic shoulder pain, maybe you're doing cortisone every 3 months, you've been told eventually you're going to have to have surgery. That's not necessarily the case. Not the case. Check out our website, buckeyepmr.com. Make an appointment. We don't charge for a consultation. Come in. It's a free doctor visit.
And always get your blood work done.
Get your blood work done too. But yeah, come in, get checked out, and if you qualify, we'll let you know. And if you don't, we'll let you know too. You have nothing to lose. It's not going to cost you anything. So, I appreciate you coming on here today.
It's always a good time.
It was good. Jim, you want to add anything in there?
Jim's good.
Jim's good.
He's stressed.
He's stressed. All right. Well, until next time.